A new report is casting doubt on Canada's ability to retain highly skilled immigrants. The report was commissioned by the Institute for Canadian Citizenship. It states that those highly skilled immigrants are the most likely to leave Canada within their first 5 years living in the country. Statistics also show that the higher the level of education, the more likely someone is to leave. People with a doctorate are more than twice as likely to move away from Canada than people with a bachelor's degree. The Institute also found that 1 in 5 immigrants leave Canada within 25 years of being accepted as permanent residents. Let's dig a little deeper into these findings. Danielle Bernhard is the CEO of the Institute for Canadian Citizenship. It's an organization that aims to help Canada retain and integrate immigrants. Were you surprised by what's in this report, Daniel?
Surprised, not really, but distressed nonetheless. Look, what these data show us is that people who are clamoring for the immigration system to shrink for a supposed restoration of quality over quantity have nothing to celebrate here. The immigrants who are leaving the country are most educated and are most qualified, the people who are best equipped to help Canada achieve our goals. And so we can look at this from a compassionate frame as one of immigrants who have been sold a false promise. I do to some extent, but also just from a pure self-interest perspective. Why are we letting healthcare professionals, AI experts, engineers, architects, the people who can help us to achieve our goals to leave the country at astonishing rates? I think that's just an exercise in really unfortunate and avoidable self-defeat.
Okay, so when you say being sold a false promise, give me an example of that.
Well, there are people who come here who are doctors and nurses, for example. In Canada, 28,000 people died last year awaiting a medical procedure or diagnostic. 6.5 million of us don't have a family doctor at all. It's a very well-known crisis. So who loses when immigrant healthcare professionals leave the country at 36% above average compared to all other immigrants? I could go, on and on. I mean, we talk about doubling our non-U.S. trade volume, for example, but seasoned executives with the global Rolodex that can help to connect us into all of these business relationships are leaving the country at 193% above average. These are exactly the very people who are recruited here to help Canada address its most pressing needs. And when they leave, our needs do not leave with them. So immigration at its best is about attracting the most talented people from around the world to come and play for Team Canada so that Team Canada can be strong. And when those people leave, all of us lose.
So let's talk about business executives, for example. Is it possible, and I assume it is, that some of the people who come here and choose not to stay here, to what extent do some of them make the wrong assessment of whether their skills actually mesh with their businesses of choice in Canada?
I mean, the rate of onward migration is not going to be zero ever. There's always going to be some people who are going to leave and move on. That's natural and healthy and expected. And maybe in some areas like business executives, we can expect a higher than normal rate. I think the point is that we continue to think of immigration predominantly, or I allege anyhow, that we continue as a nation to talk about immigration as though it's an act of charity, as though we're here doing immigrants a favor. And to some extent we are. There are people seeking refuge and asylum, and I'm glad that we're able to provide safe harbor. But most of the time, Canada needs immigrants far more than they need us. And so retention, especially of these exceptionally talented people, handpicked to be able to address our most pressing needs, this is a matter of national interest, of self-interest for each of us. I think if there's one story that comes out here, it's the need for us to implicate ourselves in this problem. This is not just about immigrants' well-being being at stake. It's about you and I waiting longer in the waiting room, having longer childcare waiting lists, being slower at building housing and infrastructure, all the things we say we want. We can attract people from around the world who know how to do this and bring the world's best to Canada, or we can let that talent continue to slip away at really, accelerating rates that harm us. So I think that's the choice here that we face, and hopefully we'll begin to take retention more seriously as a result of these findings.
We have just a minute, but you mentioned doctors and nurses. You mentioned the 6.5 million Canadians who don't have a family doctor. How many doctors and nurses who have been internationally trained leave the country? And of that number, what percentage were just not qualified? Like, some of it's probably bureaucratic, but some of it may have to do with not being able to meet Canadian qualifications. So how many are we talking about? And what percentage of those people just wouldn't make the grade in Canada?
That's a lot of math, and I don't have a napkin here on the studio to be able to do all the full calculations for you, but I can give you a sense of it. In Ontario alone, there are an estimated 20,000 internationally trained nurses, at least 5,000 internationally trained doctors. And even if you want to take the whole accreditation thing out of it, the immigration system is now becoming so restrictive that we are about to deport people, Americans, who are already in Canada, already working as doctors, serving 2,000 patients in some cases, and not granting them permanent residence because they don't have enough points to qualify. The system has become so restrictive and competitive. I could go on about this. I think the issue is there are many, many people who are very qualified. You know, the laws of commerce may vary between Canada and Singapore, but the laws of physics do not, and our kidneys still work the same. There are many people who are qualified here who are prevented from becoming doctors because they can't seek residencies, for example. 90% of residencies, which are required to complete medical school, are off limits to international medical graduates, and we don't exactly tell them that before they come. So this talent is sitting on the sidelines when it could be on the front lines where we need it so very desperately for our own well-being. This is not an act of charity, this is an act of self-interest, and we ought to pursue the retention of this talent to keep them on our team because we want our team to be stronger, and we really need this. We really need their skills right now, especially in areas like healthcare.